Well, Monday marks International Childhood Cancer Day, and South Africa has among the highest childhood cancer mortality rates, with 2/3 of children never reaching a specialist treatment center. And by the time they do, their cancer is often in an advanced stage. Now, to discuss this further, we joined via Zoom by Dr. Monica Vaithilingum, who is a paediatric haematologist and a board member of the South African Bone Marrow Registry. Thank you so much for coming through.
Good afternoon, Colin, and good afternoon to your viewers, and thank you for having me.
Paint for us a picture of how prevalent is childhood cancer in the country.
Our figures are quite high. Childhood cancer as a general, globally, is increasing. So we're seeing more than 400 new patients per year between the ages of 0 and 19 years. And in our country, we're reporting between 800 and 1,000 new cases per year. Taking into account that not all of those cases might be coming to us. So we might be underreporting because patients might not be reaching facilities in the country.
So what types of cancers are there amongst children?
The commonest type that we have is acute leukemia, followed by brain tumors and lymphomas, which is a cancer of the glands. And then we see children's cancers in the kidneys, in the adrenal glands. And so those would make up the commonest types of cancers that we see in children, which are different from adults.
So when one is happy to receive a bundle of joy, how would one detect if their children have signs of cancer? What should they be on the lookout for?
Thank you, Colin. That's a really important question because I think the whole idea about getting our children to diagnosis and treatment is awareness. So the common symptoms and signs of childhood cancer can be quite vague, and therefore people need to be educated. The public needs to be educated. So it could be simply things such as unresolving fevers, loss of appetite, loss of weight, any persistent symptom, a child who's presenting with frequent bruising or child that's looking extremely pale. Then you have children who are presenting with bumps and lumps anywhere. So that could be glands that are enlarging, which might even just be painless glands. And so often parents might not think to take their child to a caregiver. Masses or lumps on the limbs, on the testes. A mom might find a lump in the abdomen of the child when she's bathing the child. A child that's presenting with aches and pains, so a backache or a limp or pain that is significant to impair the child's mobility, abnormalities in the eye. The child suddenly presents with a squint or a white spot in the eye or loss of vision. This might be related to a tumor behind the eye. Or, brain tumors I've mentioned are second largest cause of childhood cancer. Patients can present with persistent headaches and vomiting, sudden loss of function of a limb, a loss of balance. So these would be some of the common symptoms. I think the key thing is that if there's a sign or symptom that is persistent or is getting worse, then that child should seek a healthcare provider.
Access to medical care in South Africa varies according to the living standard measure. And one would imagine how expensive medication for cancer is. So then how does one go about accessing treatment, linking that to affordability?
I think we have a reasonable referral system in place, and we have very good tertiary and quaternary hospitals where we can deliver service of care for our patients with childhood cancer. And I agree with you, it is expensive, and there are loopholes in the system. We do run out of drugs. Some facilities don't have proper radiation facilities, and that is an issue. However, the most important thing is that that child gets detected, that child gets referred on, so that we can try to deliver standard of care to that patient. But having said this, we still have to have all the stakeholders come on board so that we can ensure, and that is the Department of Health, pharmaceutical companies, NGOs and NPOs that are linked to childhood cancer. Everybody needs to work in a collaborative manner so that we can make an improvement and make a difference to these children.
So what should be happening on the Child Cancer Day regarding the activities so that they can appeal and conscientize people across all ages in the 9 provinces and also according to different races? Because you'll remember that there's this misconception that cancer is for only a certain race and others are excluded from that. But when it kicks in, it surprises all and sundry.
Sure. So the global initiative for international childhood cancer is to raise awareness and to provide support for children who are diagnosed with cancer, survivors, and their families. So we should as a community try and dispel all myths that are related to childhood cancer to ensure that people realize that this is a very treatable disease. In fact, up to 80 to 85% of children with acute leukemia can be cured, which is an amazing feat. So people and the public and families need to be made aware that it's important to seek help and to get this help. So awareness is key. And then we need to ensure that our services that we provide for the patients are adequate and the referrals to the relevant departments are in place. And, the South African Bone Marrow Registry, for example, will provide donors specifically for those patients with leukemia and lymphoma who are requiring stem cell transplantation. Remembering that this group of patients is very select, and if they require stem cell transplantation, it's a life-saving procedure. So we also need to raise awareness about increasing our donor pool, because at the moment we have quite a discrepancy in terms of racial or ethnicity, I should say, on the registry itself. Right. So all of those things will impact our level of care to our children with cancer.
All right. Thank you so much for making time for speaking to us right here on SA Today. We are speaking to Dr. Monica Vaithilingum, who is a paediatric haematologist and a board member of the South African Bone Marrow Registry.
Thank you.